Okay, so for our current event in public health, we did increased levels of flu hospitalization rates.
Okay, so why is this an issue? We're currently in the middle of one of the earliest as well as the most severe flu seasons on record. The CDC states that the flu hospitalization rate nearly doubled during Thanksgiving week. The numbers went from 11,378 people admitted to the hospital per week to 19,593, which is quite a big jump. The flu is spreading at high rates in 45 out of 50 states, or in the United States, but it's mostly affecting older adults who are unvaccinated. Overall, there's been 4,500 deaths so far this season. How does this relate to public health? So the flu is a communicable disease, which we've already learned about earlier this semester, and it's a disease that is passed from an infected person to a previously non-infected person. This particular communicable disease, the flu, can affect anybody, but like I said before, older adults are the ones who are most at risk. And then primary prevention is the first level of prevention that keeps people from getting ill or injured in the first place. And this relates back to the flu because this prevention method is the flu shot. And Dr. Kavita Patel said that almost everybody she's seen test positive for the flu at her community health center in Maryland is unvaccinated. So that kind of proves the effectiveness of the flu shot.
Okay, so there are a few major impacts because of this event. So anyone can catch the flu, but specifically children under age of 2 and anyone that's older than 65 is at a higher risk. And then those that have pre-existing lung and heart conditions, their symptoms can worsen. And so this increases the severity of the flu and their need to be hospitalized. And then those that are in group work and in living situations are at higher risk because it is more easily spread. And so those that can't work because of the flu, there's an economic impact because of their loss of work time. And then because so many people are in the hospitals, many of these hospitals are understaffed, and then they do not have the proper supplies needed to help the patients and to help improve their symptoms. So, in response to this event, the government has suggested vaccination. And so the CDC said that the most important job of these vaccinations is to save your life and to keep you out of the hospital. So, this is what they're saying to influence people to get vaccinated. And so, because of this, more people are getting vaccinated. However, there are still a group of people that are against vaccines in general. And so they're not agreeing with these recommendations and therefore they're not being vaccinated. However, the more people that are vaccinated, this creates group immunity. So overall, like the community is more protected and there's a less chance of people getting the flu and them being hospitalized.
That's right.
No, you're
Right. That's it.
Okay. And
Was
then
that it?
yeah. And then for our discussion questions, our first question is why have so many people prioritized the COVID vaccine yet disregarded the importance of the flu vaccine? And then what are the discrepancies between the two? So we brought this up because like so many people have gotten the COVID vaccine, yet there's also a good amount of those people that have not gotten the flu vaccine. And so it's important to understand like their thought process and like why they haven't gotten both.
And then our second question was, do the hospitalizations have a relationship between the flu and pre-existing health conditions? It kind of goes off of what we talked about before about how older adults are more likely to get it. So like we were kind of wondering if when older adults do get hospitalized, if it's because they already have pre-existing health conditions and the flu kind of made it worse, or if it's strictly because of the flu. And that was something that we really didn't know. So and then these are our references, and that is
Thanks
it.
for watching.